Welcome, everyone. I'm Jennifer McGee, the project coordinator for the California Evidence-Based Clearinghouse for Child Welfare, or CEBC for short. I would like to thank you all for joining us and welcome you to the webinar. Thank you for answering the poll question. This is helpful information for our presenter. We've muted your phones due to the high number of participants attending. So if you are experiencing any technical difficulties or having an urgent question, please use the Q&A pod located on the right side of the screen, and we will do our best to assist you. We will also have a brief Q&A section halfway through the webinar. Please use the Q&A pod to send us your questions. Lastly, you will receive a link shortly after the conclusion of this webinar to complete a short and easy survey so we can continue to improve our webinars and make them as useful and beneficial as possible in the future. Now, a brief introduction of our presenter. Stephanie Lee is a Senior Research Associate at the Washington State Institute for Public Policy, WSIPP, a nonpartisan organization created by the legislature to carry out practical research on issues of importance to Washington. Since 2007, Stephanie has been focused on identifying and evaluating the research evidence for programs and policies that affect children, particularly in the areas of child welfare and mental health. Her current work is centered on long-term economic impacts of strategies to improve outcomes for people in the state of Washington. Stephanie leads WSIPP's work with the Results First Initiative, a collaboration between the MacArthur Foundation and the Pew Center on the State. This project aims to develop and extend the capability of WSIPP's benefit cost software and to support other states in using the WSIPP benefit cost approach in their own specific content. I will now pass it on to Stephanie.
Thanks so much, Jen, and good morning, everyone. I'd like to thank the CEBC for sponsoring this webinar and inviting me to participate. I'm really excited to talk to all of you. And just as a little bit of background, as Jen noted, I've been with the Institute for Public Policy since 2007. And the first project I was assigned was to assess the research evidence and the benefits and costs specifically for programs used in the child welfare system. So one of the first resources I really looked at was the California Evidence-Based Clearinghouse for Child Welfare. And it's been wonderful over the years to watch that resource grow and become so sophisticated and so rich with information. It's a wonderful resource for researchers, and I'm sure it's also incredibly useful for practitioners as well. So today I'd like to talk to you about three basic things. First, I want to give you a very brief little background on the Institute for Public Policy, or WSIPP as we call it. I'd like to explain our basic methods for how we compute the benefits and costs of different kinds of policy and program options for the state. And then I'd like to give you some really specific examples from the child welfare world. After I talk about the methods, we'll do a break for questions on that section. And then we'll do another break for questions at the end. So I do hope people will feel free to ask questions. That's one of the ways that I know that I'm communicating effectively is if I get some good questions and can answer those for you. So the Washington State Institute for Public Policy was founded in 1983 by our state legislature. And you can see in the right-hand corner of your screen there's a picture of the lovely city of Olympia, Washington, where I'm speaking to you from today. And that body of water there is the Puget Sound, and we're located right at the southern end of that. And you can see in the middle of the screen a very small little building, and that's our state capitol legislative campus. So that's where we derived from in 1983. And as Jen mentioned, we were founded as a wholly nonpartisan objective research group of general purpose to the state legislature. So all of our assignments generally come from the legislature in the form of policy or budget bills. So all the reports that we do are really written for a legislative audience. We post them on our website, but they're really written for a legislative audience. We also take assignments from our board of directors. That's made up of 12 people who are from the state House and the state Senate. members of the higher education community in Washington State, as well as executive and legislative officers in other agencies. So we generally get three types of assignments. First of all, we tend to get general assignments that explore how Washington state policies might fit in with other states' policies, sort of where Washington fits in the whole national scheme of things. Second of all, we oftentimes get assignments to conduct outcome evaluations of programs that are actually being conducted in Washington. So we're assigned to look at how the outcomes for people participating in state programs might differ from those who are not participating in those state programs. And then finally, over the last 15 years or so, we've increasingly been asked to look at the long-term economics of particular state budget choices. And this work really started in the criminal justice arena in the mid-1990s. And since then, our work has grown into a number of different areas like education and child welfare, substance abuse, mental health, general prevention for young children, and so on and so forth. So when the state legislature asks us to look at the long-term economics of different choices, they're really asking two different questions. The first question is what works and what does not? And this is a question that a lot of people are trying to answer all around the country. The Evidence-Based Clearinghouse is one great example of that, trying to figure out what's effective for different kinds of people in what kinds of situations and so on and so forth. So the way that we get to that question is we look at all of the rigorous evaluations that we can find on a particular program or policy, much as the CEBC does for programs in child welfare. So we look for everything that we can find, and then we distill information from those things. And I'll get more into the specifics of exactly how we determine what works in just a few minutes. But the second part of that question is where the legislature is asking us to take it another step. So not only are they interested in what works, but they're also interested in what's economic. So given what we know about what works, how can we estimate the long-term benefits, the long-term costs, as well as the risk to the people of Washington? So we're interested in a number of different factors that all impact the safety of investing in particular kinds of options. We've developed a consistent framework for answering these questions. So regardless of the policy area or the topic area that we're asked to investigate, we have a standardized way of getting to those benefits and costs in different areas. There are a number of different ways to look at the long-term economics of different options. So for example, some people might use cost-effectiveness analysis, which says, how much is it going to cost me to achieve a particular outcome? So how much would it cost to increase the rate of high school graduation in a state? Or how much would it cost to decrease the rate of crime in a state? These questions are great questions, but with benefit cost analysis, we're actually trying to put things on an equal footing. So when we talk about dollars and cents, we consider that sort of a consistent basis for comparison. So rather than making a value judgment about whether it's better to spend our money in increasing high school graduation or better to spend that money in decreasing the crime rate, we just look at the long-term total benefits and see if those outweigh costs for particular policy options. The societal perspective that benefit cost analysis entails is really appealing to legislators, because what it does is it says, well, not only are we interested in the outcomes for the people who are funding a program or policy initiative, like the taxpayers might be funding a program or policy initiative, we're also interested in what happens to other people in society. So what's happening to the people who are participating in the program? What are the indirect impacts on taxpayers? And then what are the impacts to still other people in society? So I put together a little table here to show you on the left-hand side, there's two outcomes described that are of particular interest to our legislature, crime and high school graduation. So if we think about preventing crime, if we think we can prevent a crime from happening, that means that we're going to have to spend fewer dollars in the criminal justice system. And that means that taxpayers are going to save a little bit of money. In addition, if we prevent a crime, we also are potentially preventing a victim of a crime from occurring. And that has to do with dollars that come back in terms of property costs, mental health costs, quality of life costs. So you have these other people in society who are not necessarily funding the program or participating in the program, but nonetheless, they're still benefiting. So that's something that benefit cost analysis allows us to pick up. Likewise, if we think about high school graduation, if a child participates in a program that's demonstrated to increase their likelihood of graduating from high school, that means they also have an increased likelihood of earning more money over their lifetime. And so those earnings are direct benefits to that participant in that high school graduation improvement program. But if that child eventually earns more money, they will also be paying more taxes back into the system. So taxpayers will indirectly benefit from that program as well. So those are all the different kinds of things we think about when we're looking at benefit cost analysis and trying to break down all of those different perspectives in society. Benefit cost analysis is kind of appealing across the political spectrum because it really focuses on improving outcomes for people in a state. For example, we always talk about Washington State, but it also talks about either saving money or doing something that's going to potentially increase money in the future. So it's really appealing to members of all political parties. It's also useful in all kinds of budget situations. So if there's a budget surplus and legislators are interested in how they're going to most effectively spend that money, then we can provide advice based on benefit cost analysis. But likewise, if there's a difficult budget time where certain options might have to be cut from being funded, then we can also use benefit cost analysis to help inform those decisions about what's not quite as beneficial as other options. When we do the benefit cost analysis, we also really try to provide consistent comparisons. And when I talk about the consistent comparisons here, I'm really talking about the way we present our results. So a few of you may have seen the kinds of reports that we've produced before. And if you haven't, these are available on our website. Generally, the way that we present evidence to our legislature is in a pretty standardized format. Our director calls it our consumer reports list of options. For each topic area or budget area, we provide a rank-ordered list by net benefit of different kinds of options in that particular area. I know the slide is much too small to read, but it's just a demonstration of the kind of information that we present to our legislators. So if a legislator is sitting on the Criminal Justice Committee one session, and then the next year they get moved to early education, they're still used to reading our reports. They still know what they're looking at. So we try to really provide things in a consistent framework across different types of policy and budget areas. So to get a little bit more specific, those two questions that our legislature asks us, what works and what's economic, in order to get to those long-term economics of state budget options. There's a few steps involved in figuring those things out. So in order to figure out what works, as I mentioned earlier, we first take all of the literature that we can find on a topic and systematically review it. So this is a very similar process, again, to the process that the Child Welfare Evidence-Based Clearinghouse goes through. But we have somewhat different criteria. So we apply certain standards of evidence to the studies that we review. We look across the research literature. We include not only peer-reviewed literature, but also things that might be considered gray literature. So government-sponsored evaluations or private evaluations sponsored by different people in society. We look at everything that's been published in any way, and we apply our standards of evidence. So what we're really looking for is all rigorous evaluations that we can find of whether or not a particular program or policy initiative is effective. So I put together a little table here that shows the things that we like to see on the left-hand side and the things that we don't like to see on the right-hand side. And this is not an exhaustive list. It's just a few examples. So we love seeing randomized controlled trials when we're reading through the research literature and we're scanning it for inclusion in our analyses. But we also like strong comparison group designs. We also like regression discontinuity designs and interrupted time series. What we're really looking for is evaluations that allow us to infer a causal impact. So, so we're somewhat more inclusive than other organizations when we're applying our standards of evidence. We look through the literature to find real-world evaluations. We're much more interested in things that happen in the real world because then that makes us much more confident that we could potentially replicate that effect in Washington state on the ground. We also focus on intent to treat analysis, so we don't include analyses of program completers only, for example. We don't like single group evaluations, pre, post-test designs, or poorly matched controls. We try to keep things pretty rigorous without excluding absolutely everything that there is out there. So after we apply our standards of evidence, we then take those selected studies and we code them with rigorous standards. And regardless of what topic area or policy area we're looking at, we apply the same standards and the same procedures across all of those different areas. So all of our analysts are trained in a consistent fashion to make some consistent choices about the different studies. And once we have coded all of the outcomes for a particular kind of program or policy, then we meta-analyze those findings across evaluations. So for every outcome that's measured, we meta-analyze all of the studies that have looked at that outcome in a particular program or policy area. And we then quantify that magnitude of the impact. So we calculate effect sizes for every combination of program and outcome that we code. And then we combine those meta-analytically to come up with a weighted average magnitude of expected impact. So I've put a little graph together that demonstrates this. And what this shows is, on average, without treatment, the blue line shows what we would expect for a high-risk population in terms of experiencing abuse or neglect by age. So according to the national and state data that we've put together, we would expect over 20% of children in high-risk families to experience a case of abuse or neglect by age 17. Now, what the dotted red line shows is the impact of participating in a prevention program. And these represent our findings from the Nurse-Family Partnership, for example. So what that shows is that with participation in the Nurse-Family Partnership, on average, we expect that likelihood to drop to about 15% cumulative abuse and neglect by age 17. So that's a fairly big difference. And you can see that it forms sort of a wedge in between there. And that's the magnitude of the expected impact of a program that we eventually apply to benefits. And I'll get to that in just a moment. So just kind of keep that wedge in mind as we move forward in this presentation. The next part of the equation is figuring out what's economic. So first of all, we tried to estimate realistic Washington state-specific costs of program implementation. So if we're going to be giving our legislature advice about which options are economic, we want to be pretty clear on what those things are going to cost to implement in Washington. Certain programs we already have in Washington state, so it's fairly simple to estimate how much additional families will cost to serve in Washington state. But in some cases, all we have to go on is the published evaluation literature. And so in those cases, we try to read the literature very carefully to figure exactly what's happening in an evaluation and then apply Washington state-specific costs. So if there's a program that involves some kind of home visiting by a nurse, then we can apply what nurses get paid in Washington state to the number of hours that were involved in the actual program evaluation literature. So the next step after estimating the cost is trying to apply the magnitude of each effect to the estimated benefits of each outcome. So that wedge I showed you of the magnitude of the impact of that program, nurse-family partnership, on one outcome, child abuse and neglect, that magnitude gets applied to the expected benefits of avoiding a case of abuse and neglect. Similarly, the other outcomes measured in evaluations of nurse-family partnership, we also measure the magnitude of those impacts and apply those to the relevant benefits expected from, say, increasing high school graduation, increasing test scores, avoiding crime, and so on and so forth. The kinds of monetizable outcomes that we look at are somewhat restricted, I would say. We're looking at things like crime, high school graduation, child abuse and neglect as measured by administrative records, K-12 education outcomes, substance abuse, mental illness, and so on and so forth. This is actually one of the limitations of benefit cost analysis, because there are certain things that we don't know, economists don't know how to apply a long-term benefit to. So say parent attachment styles. We don't yet know. We don't have the information necessary in order to apply long-term benefits to those kinds of outcomes. Parent-child relationship styles. We can't quite quantify yet. But the things listed on the screen here are examples of things that we can quantify. And we've got quite a lot of literature on how to quantify. So once we apply the magnitude of the effects to all those different benefits over time, then we look at the bottom line. Do those total benefits outweigh the costs of implementing the program? Finally, we ask, what's the risk of failure? So we know that in a lot of different evaluations, there's a lot of measurement error around things like estimating program impacts or calculating the cost of implementing a program, or economic factors like discount rates in the future. So what we do is we run a risk analysis, Monte Carlo style, which means that we randomly draw from within defined distributions for a number of key parameters, about 15 to 20 different parameters. And then we run our risk analysis thousands of times, and we figure out for each of those runs, those risk runs with randomly drawn inputs, what's the likelihood that that bottom line is going to come out successful? What's the likelihood that the bottom line benefits are going to outweigh the bottom line costs? So that's really a very simple measure of risk that we always present to our legislatures. So just for a little bit more of a specific example here, when we think about the monetary benefits of preventing child abuse and neglect, we think about a number of different factors. So first of all, we think about costs to the system. If you can avoid a case of child abuse or neglect, then you're going to avoid potentially using child protective services. You potentially will avoid having the police have to come to a family's home and remove the child. You might avoid dependency hearings, termination hearings, foster care for certain children, adoption support way out into the future for kids who eventually get adopted. So what we do is we put together an expected value. So for every child abuse and neglect case that gets screened in, we calculate the proportion of kids who are going to potentially encounter each type of service. And then for each type of service, if it is experienced, what's the average cost of that service? So we come up with an expected value for each potential avoided case of abuse and neglect from the system perspective. We do the same thing from the victim perspective. So we know that victims of abuse and neglect are going to have higher medical costs, going to have higher mental health costs, and also will have big impacts to quality of life, which have been quantified by economists. So overall, we think that the pie of potential monetary costs of abuse and neglect looks something like this. So the large green piece really reflects those victimization costs, those quality of life costs. And the blue slices represent things like the system costs, the investigations, the courts, and so on and so forth. So for each expected case, we think that the average lifetime cost is around $30,000. Of course, that varies tremendously depending on the age of the child and the type of abuse experience and so on and so forth. But on the average case, that's our best estimate. The other piece of valuing child abuse and neglect in this kind of way is that we know that there's a huge literature of impacts of victims of abuse are more likely to experience negative outcomes in their life, in addition to those system and victim costs we just looked at. So we know that kids who are abused and neglected are more likely to get involved in the criminal justice system later in their lives. They're less likely to graduate from high school, more likely to abuse different kinds of substances, and more likely to experience episodes of major depression later in their lives. So all of these things, of course, have costs associated with them as well. So when we think about avoiding a case of abuse or neglect, what we do is we roll all of those costs together to come up with a single number that's deceptively simple. It looks like a single number, but it really has all of these potential costs rolled into it based on the magnitude of the impact of a particular program or policy option. So I know that that's been quite a lot of information thrown at you in the last 25 minutes, but if there are any questions from the audience, I would be more than happy to try and answer them.
If you have any questions, please type them into the Q&A section on the right-hand side of your screen, and we will have Stephanie answer them as they come in.
Perfect. Okay, so there's one question here. It says, have you assessed the Triple P Positive Parenting Program? Yes, we have, and there's really two different slices of Triple P that we've looked at. We've looked at the large system trial that was conducted in South Carolina, and that's the brand of Triple P. I know that's a silly distinction to make, but that's the type of Triple P was sort of a system level, all level kind of media campaign plus targeted interventions where needed. So we did estimate the magnitude of the impact on child abuse and neglect and out-of-home placements. And so we have reported on those impacts. And it looks like a positive benefit to cost result. We've also looked at it in the mental health side. So there have been a number of studies of Triple P that have looked at the behavioral outcomes for kids with pretty serious behavior problems. And those results also look somewhat positive as well. That those outcomes, there's sort of two different sets of outcomes for Triple P, but we do have published results on both of those kinds of studies. The next question is the child behavior checklist monetizable? And yes, to the extent that it measures internalizing and externalizing behavior and that those things are reported separately. We have found a pretty large research literature on the impacts of internalizing and externalizing symptoms on future outcomes. So yes, we do include those. The thing is with the child behavior checklist, the research literature that we found really only shows the monetary benefits of when you're treating a very high-risk population, so kids who are kind of already at the clinical level on the CBCL. So we don't really know much about the prevention in non-problem populations of the CBCL, but we have pretty good estimates of the internalizing and externalizing components of that for disordered populations. Let's see. Next question is, what is regression discontinuity? And that is a type of study design where there's a sort of a kind of a cut point. Like for example, if you think about programs that target low-income families, there's usually some kind of cut point, like 150% of federal poverty level, which is the criterion for getting into a particular kind of program. So if there's a design where it's not possible to look at a group of kids who were assigned randomly to receiving an intervention program versus a group of kids, similar kids who were not assigned to get that intervention, you can actually use that cut point to create bands on either side of the point to look at kids who got into the program by virtue of being just over the limit, or rather just under the income limit, versus the kids on the other side of that cut point who almost made it into the program but didn't quite because their income level was a little bit too high. So it's kind of using that somewhat arbitrary cutoff to create groups that you can then compare later on. Let's see. Another question here is it possible to use these methods to do a benefit cost analysis on implementation of programs in child welfare where a case of abuse already exists? Yes, and that's actually something that we've recently tried to kind of quantify more carefully. So we have in the back end of our model, we have a number of different defined populations. So that baseline that I showed you in that earlier slide of a prevention population in a high-risk situation reaching a likelihood of over 20% likelihood of experiencing child abuse or neglect by the age of 17, that curve looks a lot different when you're looking at a population of kids who have already experienced abuse or neglect. They're actually much more likely to experience a subsequent case of abuse or neglect. And their likelihoods of getting removed from home are also very different. So we look at those two populations separately in our benefit cost model so that we're better able to tease apart the impacts for programs that are aimed at prevention versus those that are aimed at intervention. Another question is the standardized coding procedure for reviewing studies available to the public? It is. It's written up in our technical manual, which is posted on our website. And I should mention that our website will be updated, I believe, on Monday. It's scheduled to go live, and we'll have a brand new technical manual that's presented on that website that's available for public reference. And it goes into some great detail about how effect sizes are calculated given different types of data, but also those screening criteria that we use when we code different types of studies. Let's see. Can your data be presented in terms of the return on investment of child welfare services? I'm probably not going to understand this question fully, but I think what you're asking here is if the return on investment to child welfare services specifically. So if you spend certain money on child welfare services, what's the likelihood that that money is going to come back in terms of avoided child welfare services? And we do have that capability. It's sort of newly developed in our model, and we haven't quite figured out how to best present that to legislators yet. It's sort of a work in progress, but essentially what we're trying to do with that is say, if you're investing more money in child welfare, we know that certain things will be avoided, like maybe certain amount of out-of-home care or a certain amount of victimization costs, but those out-of-home care costs are directly relevant to those child welfare services. And so we are working on kind of how to tease that kind of information out of our model. Let's see. Another question is, how do you estimate the impact to quality of life? And did you estimate the probability of the child abuse or neglect event happening without the prevention program? So the answer to that first part of that question, the impact of the quality of life, is we rely on economists who have been doing this kind of work for years and years to estimate the impact of things like quality of life. There are certain things like future earnings and health care costs that we can get a much more specific handle on, but the quality of life impacts oftentimes are based on economic studies of willingness to pay kinds of methodologies. If this happened to you, how much would you be willing to pay to prevent it from happening to you, and so on and so forth. There's a number of different methods that are used to estimate those quality of life impacts. And so we essentially just synthesize the analyses that multiple economists have done in order to come up with those impacts. And estimating the probability of abuse and neglect happening without prevention programs, it's based on a mix of data from national and state sources. And so, the NCANS study that's published every year gives the likelihood of first-time victimizations by age, and we combine that with certain things that we know about Washington State in order to come up with a likelihood of abuse and neglect cumulatively over a child's life. And there's a really interesting question here about giving more weight in the meta-analysis to regression discontinuity designs than matched comparison designs. And it's a really good question because we potentially do. So we actually rate studies on a scale of 1 to 5, depending on the program design. And so, for example, a really well-done randomized controlled trial that had very little attrition and little loss to follow-up and little crossover would be rated a 5. That's kind of, we would consider that the gold standard. A level 4 might be a randomized controlled trial that was a little less well done or a little less well followed up or something like that. A level 3 is a really, really rigorous comparison group design or regression discontinuity design. So we kind of categorize these things. And what we do after we've compiled a number of studies in a particular area, say, well, several hundred studies usually, we'll actually do meta-regressions to figure out if those levels of rigor have impacts on the effect size measurements, so the magnitude of the impact. When we were first doing this work, we made an assumption that lower quality or less rigorous studies would have higher effect sizes than studies done with more rigor. And as we've progressed over time, we found that in certain areas that's not really true. So in many areas, such as crime and K-12 education, as long as a study meets a minimum criteria, like a very strong matched comparison group design, if it's that or anything better, the effect sizes are all about the same. In certain areas like child welfare, we actually do sort of do a post hoc discount of effect sizes that aren't at that RCT level. So it really depends on the program area and the designs that have been used in that area over time. But we try to empirically apply different kinds of weights depending on our meta-regression analyses. And then a great question here again is if costs in California are X% higher than in Washington, do you think it would be justifiable to multiply your savings by that factor to estimate cost savings in California? And I would say no, to be cautious, because in general, what we find is that costs might be higher in certain areas, but not in others. And the model is so complex that you've got criminal justice costs might be much higher in California than in Washington, but child welfare costs might actually be lower. I'm not sure on that. I'm just kind of speculating here. But with all the different possibilities, you might also have, if you have higher costs of those outcomes, you might also have higher costs of implementation. And so it's possible that those differences in costs could kind of wash out and you might wind up with the same net result. I will be talking a little bit later about implementing this kind of approach in other states, and there are some really important factors to consider when trying to apply these Washington State results elsewhere. There's sort of a good general guideline, but it's good to keep in mind that we use very specific Washington State costs in order to estimate these results for our legislature specifically. So it's possible that the results would not hold in other places, or they may differ in small ways or large ways. It's really hard to know without doing a full analysis of the different costs associated with these services. And there's quite a few more questions. I'll just take a few more before we move on to the next section. Someone asked, what is the downside of pre and post-test surveys? And I think what we're talking about there is when certain evaluations look at change over time in a single group, we often don't know how that change would have happened in absence of an intervention. So if you're looking at some kind of parenting class, for example, and you've got a measure of some kind of behavior measure for the child that's a survey given to the parent, and you give that to them at the beginning of the class and at the end of the class to measure how behavior has changed, well, it's really difficult to know in the absence of a comparison group whether or not that change would also have happened in the comparison group. Um, it's so without the intervention, you really need to know what happened with and what happened without the intervention in order to be pretty clear that you're looking at a causal impact of a program. Has the Washington State Institute for Public Policy looked at, studied the cost benefits of team decision-making meetings in child welfare? We do have some meta-analytic results that are specific to Washington State that are published on our website and in a couple of different reports. But we haven't gotten to the benefit cost. It's really difficult to estimate the additional costs of things like team decision-making that some people would consider standard practice in the child welfare system, and other people would consider something separate. It's just essentially, it might be seen as an alternative way to spend time, although there are often many costs of transportation and lost opportunity from other members of the family who might participate in those kinds of programs. But it's difficult to get a consistent sense of what those costs actually are. And I hope we can get there eventually in the future. Another question is, how do you account for the benefit cost of averting a child's death? And that's a question that is incredibly difficult to look at. Fatalities are relatively rare occurrences, as we know. They happen, and we have actually been asked to look at some of these sorts of things, but it's incredibly difficult to assess the impact of a program on avoiding a child fatality. Again, just because they're so rare, it's very unlikely that any intervention that we can do, it's very unlikely that a child death would be avoided from those interventions. So it's actually a category that's actually left out of our analyses. And some would say that's for better, some would say that's for worse, but that's just the state of affairs at the moment. And then the last question I'll take before moving on is, would you please repeat your website address? It'll be on the last slide, but if people want to sort of look it up while we're doing the webinar here, it's www.wsipp.wa.gov. So wsipp.wa.gov. And I hope that will be useful to you. I mentioned earlier, and I'll mention again at the end of the conversation here, our website is currently being updated, and we expect it to go live on Monday. So the website that you look at today will look somewhat different on Monday, but we hope that it will be easier to find what you're looking for on the new site. Okay, thanks everyone for the great questions. I hope you'll have more at the end of the conversation. But let me just move on to some of the specific results that we've gotten to. And some of the things that I'll be talking about in the next few minutes were addressed in the QA session, but this will give you some more specific information, hopefully. I thought what I would start with is just a list of the programs that we have found to be cost beneficial, where the benefits outweigh the costs in the expected case. So on average, the next slide will be a list of the programs that are most relevant to child welfare that we have found that the benefits on average outweigh the costs. So you can see here there's quite a number of different interventions, prevention, intervention, as well as treatment programs, nurse-family partnership, home builders, CBT and EMDR for trauma, and so on and so forth. So there's a whole bunch of different options here where we think that on average the benefits outweigh the costs. Now, I mentioned earlier that we do a risk analysis to help our legislature make better decisions. And so I've also put together the proportion of the times when we run our Monte Carlo risk analysis 5,000 times, the proportion of the times that the program at least pays for itself. So given what we know about all the variability in measurement and the errors that are possible, what proportion of the time will the program at least pay for itself in our best guess estimate? So that's these numbers that are going to show up on your screen here. You can see that they vary between 76% and 100%. So that's generally speaking, when we run these programs, we would think about a 75% number is a pretty good investment. So if you think that the program at least pays for itself about 75% of the time, and on average the benefits outweigh the cost, we would think that that's a pretty good investment. So everything on this list we would consider a pretty good investment for the state of Washington. Now, on the next table, we've got a few programs that didn't quite meet that test for one reason or another. So the programs that, on average, didn't quite pay for themselves or didn't quite break even in our best analysis are listed here. There's a number of different types of home visiting programs, for example, and some intensive family preservation services that don't quite have the rigor of the home builder system, and all of those in our best estimate don't break even. And when we look at the risk numbers for these programs, you'll see that they're quite a lot smaller. So in some of the cases where we ran our risk analysis, because there's so much measurement error, in some of the cases the programs did break even, and 36% of the time, 18% of the time, 26% of the time. But on average, the benefits did not outweigh the costs of implementing these programs. Now there's another set of programs that we are very frequently asked about, and we're starting to post these findings on our website in our newly updated system. These are programs for which we just don't know if the benefits outweigh the costs. And there's a number of different reasons that this might be a possible finding. So for some of the programs on this list, we can't really estimate the cost of the program. So we might have good meta-analytic results, but we don't know how to cost out the program itself, like the family team decision-making meetings that we were talking about over the question and answer session. We just really don't have a good handle on how to cost those programs out. So we might know that they work or don't work, but we don't know how to cost them, so we can't present the full picture. Other evaluations or other programs listed here simply don't have rigorous evaluations or don't have very many rigorous evaluations, or they might have rigorous evaluations, but they haven't measured outcomes that we can monetize. So there are certain kinds of programs that just haven't measured the things that we know how to put dollar signs on, and for those programs, we simply can't present a benefit cost result. Now, to get into some of the more specific numbers, I did want to give you a few examples from child welfare. Whenever we present our benefit cost results, there's a few things that we always present in common. So when we're showing lists of programs and policies to our legislators, we always present the benefits, total benefits, but also broken out by taxpayer and non-taxpayer benefits. We look at the total costs of the program, and all of these things are presented on a per participant or per family basis, so that what we're trying to do is compare apples to apples and say, for each person who enters a program, this is the average impact that we would expect. Certain individuals might benefit a lot more, and certain individuals might benefit a lot less, but what we present is the average per participant or per family result. We look at the benefits minus the cost on a net present value sense. That NPV statistic means that we take all of the benefits that are expected to occur over the lifetime, like earnings all the way up to age 65, healthcare costs all the way out to age 80, and we discount those back to today's dollar. So what we're trying to do is present everything, again, on an apples-to-apples basis. And so instead of saying, this analysis is based on $2005 and this analysis is based on $2011, we try to present everything consistently in terms of $2012. So if we were going to invest in something today, we would express that in $2012. And then we would say, over the lifetime, we are going to expect all of these benefits to accrue, but we're going to discount those back and treat them like they're 2012 dollars so that we're looking at an apples-to-apples perspective. So we're looking at net present valued benefits minus net present valued costs when we look at the net benefits. And that's sort of the most important statistic that we think we present to legislators. That's how we rank order our programs when we present them, is by looking at the net benefits after accounting for the cost of the program. The next statistic is the benefit to cost ratio, which tells us for each dollar invested, how many dollars do we think we will get back to society? And again, that's a societal perspective, total benefits for each dollar of cost. So what we're looking for there is a benefit to cost ratio of at least $1, meaning you're going to get back at least $1 in our best estimate for each dollar that you invest. And then finally, we present the odds of the positive net present value. And so those are the green and red numbers that I showed earlier, the likelihood that a program would at least pay for itself in our best guess from our 5,000 run risk analysis. So the first program I'll highlight here is the Nurse Family Partnership. And just quickly going through the numbers, we expect $27,000 of benefits per family, compared to a total cost of about $10,000 per family. That $10,000 cost is estimated from Washington state implementation numbers, so we have a pretty good idea of what each additional family would cost to implement in the state of Washington. The benefits minus costs are about $17,000. Benefit to cost ratio is just under $3, and as we saw earlier, odds of a positive net present value are about 76%. So those are the kinds of numbers we show to our legislators, and here are a few more examples from the child welfare world, and you can see how they all look somewhat similar, but there are differences between them. I'm looking at home builders and PCIT with motivational interviewing, other types of home visiting programs, which I'll get into in just a bit, other types of family preservation programs. So you can see that they've all got very different benefits minus cost and very different benefit to cost ratios. And finally, I also want to present one example from child mental health that's directly relevant to child welfare when we're looking at cognitive behavioral therapy-based models for treating child trauma. One thing that sort of stands out about this line is that the cost of the program is actually green, which means that the cost of doing cognitive behavioral therapy to treat trauma is actually less than the cost of treating trauma as currently practiced in the state of Washington. So given what we know about what we spend on therapy for trauma victims in Washington state, it would actually be cheaper to implement CBT instead. So I'm going to go into a little bit of the detail around the Nurse Family Partnership to kind of break down that big $27,000 number of benefits. We expect, because of the evaluations done on the Nurse Family Partnership, we expect that there is an impact on child abuse and neglect. So families who go through the Nurse Family Partnership are less likely to experience abuse and neglect than families who don't go through the Nurse Family Partnership. So the expected reduction in abuse and neglect is related to lower costs to the child welfare system and lower costs to those victims who are avoided. And the total of that is about $1,200 in total. And that's all of the different components that we talked about earlier for reducing child abuse and neglect. We also know that the Nurse Family Partnership seems to increase the likelihood of mothers to graduate from high school, to sort of persist in their educations. And it also increases the standardized test scores of the children of those moms who participate. Both of those things have direct impacts on earnings of mothers and children later on in their lives, and it's a pretty big impact. We're talking about almost $25,000 of lifetime increased earnings when you include both the mother and the child in those impacts. We also think that the Nurse Family Partnership reduces the likelihood of both the mother and the child to get involved in the criminal justice system to the tune of about $6,000. And one interesting impact of the nurse-family partnership is it does seem that kids who participate in the program are more likely to use special ed services and more likely to repeat a grade. And people can make different value judgments on whether those are good things or bad things for the children to experience. But whatever the value judgment is, those services cost money. So we put them as it's a cost rather than a benefit as a result of the nurse-family partnership. We also see other impacts in terms of lower use of public assistance and lower healthcare costs into the future. And there's one little line here, the dead weight cost of the program adjustment, and that's something that I'm happy to answer in the question and answer period. But essentially, what it means is that the total benefits per family are equivalent to about $27,000, whereas the cost is about $10,000. Again, that's a net present value of about $17,000. And we also ran this through our risk analysis. So the next chart shows for each run through our risk analysis, given all of the different parameters that are varying randomly within defined distributions, for each of those runs, we come up with a net present value, which is the total benefits for that run minus the total cost for that run. So each of those net present values is plotted on this chart. And what we see here is that in most cases, in 76% of cases, we at least see the program pay for itself. It at least hits that zero mark. Every cost that it incurs, it makes up for in benefits. And on average, we see about a $17,000 net present value. But overall, you see 76% of those times, the program at least paid for itself. In a lot of cases, it did quite a lot better. But in 24% of the cases, the program did not break even. So that's just a visual example of what our risk analysis outcomes look like. And all we do is present that 76%, but there's a lot of information that goes behind that. So moving back to that benefit cost result table, I wanted to highlight this category of other home visiting programs for at-risk families. This is something that we get questions about fairly frequently. Whenever we have enough evaluations where we can actually take a specific home visiting program like Nurse Family Partnership or Parents as Teachers or Healthy Families America, whenever there are enough evaluations of that specific program, we can actually take those out and separate them and run separate meta-analyses for those programs. But there are quite a few home visiting programs for at-risk families that were only evaluated once. Maybe they were pilot programs or test programs. And so what we've done is kind of created a catch-all category for all of those other home visiting programs. Generally speaking, and this is not universal across the board, but generally these programs were done with paraprofessionals providing the services and with not very strict criteria for being at risk. So not necessarily, the families involved weren't necessarily really high risk. They were riskier than the average population. But essentially what we found is that on average, those programs did provide benefits of about $2,500 per family when we included all of the different outcomes. But they cost almost $6,000 per family to implement. So that in this case, we don't think the benefits would outweigh the cost, even though there were benefits there. So you could say that the program, those kinds of programs work, meaning that they are positively impacting certain outcomes. But because they cost so much to implement, we don't think the benefits would outweigh the cost. So I just wanted to highlight that because that is a question that we get somewhat frequently, and I wanted to make that pretty clear. The last program that I'd like to share the specific breakdown of benefits with you for is the cognitive behavioral therapy-based model for treating child trauma. So the studies that were involved in this analysis, there are quite a few studies, and so the populations in those studies were somewhat varied. So we're talking about not only victims of abuse and neglect, but also witnesses to serious violence or victims of sort of tragic accidents. Lots of different kinds of trauma were included in the analysis of the treatment of those different traumatic events. But on average, this is what we found from all of those studies. And the major outcome of interest here is post-traumatic stress disorder symptoms. So what's measured is the improvement in post-traumatic stress disorder symptoms between kids who receive CBT-based treatment for trauma and similar kids who did not receive the treatment or received services as usual. And so what we found is that the post-traumatic stress disorder symptoms were reduced to such a degree that we think that over time, increased earnings will occur based on those reduced symptoms, as well as lower health care costs. And one thing that's interesting about this category of studies is I was talking to the primary analyst, and she made it really clear that for these kinds of interventions, sometimes what you see is sometimes mental health interventions will have an impact very close after the treatment, but you might see that impact sort of fade over time. But with these post-traumatic stress disorder symptoms, the effect seems to stay pretty strong for a very long time. So it seems like if you can intervene early in the cases of these traumatic events, that the impacts that you see right after treatment will persist for quite a long time. So it's sort of good news for these kinds of treatments. But basically, we think that over time, there will be about $10,000 worth of benefits from increased earnings and lower health care costs because of treatment provided in these programs. Again, we have that little line of the adjustment for the deadweight cost of the program. But essentially, what we're talking about is almost $11,000 of benefits per participant from those long-term outcomes. And again, a cost per participant, which is actually a benefit because these programs are less costly than services as usual, particularly in the state of Washington. And that gives us, again, a net present value of about $11,000. When we look at the risk analysis chart for this particular program, you can see that in no cases in our 5,000 test runs did the program fail to break even. So we had 100% chance of a favorable outcome. These kinds of programs look like a very good investment for Washington State. So the results that I've just presented are all going to be available on our newly designed website. In the past, we have really focused on providing PDF reports, essentially PDF copies of reports that we present to our legislature. But in the new website, there's going to be a whole section devoted to benefit cost results that's much more interactive and much more easy for us to keep updated as well. So the website will look something like this, and if you go there on Monday or so, you should find this picture on the front page rather than the picture that's currently there. If you click on the benefit cost results section, it will take you to a page that's got a huge list of all our findings in different research areas. But if you click on the research area dropdown, you can filter by the different types of budget areas that we look at. And you can also enter a search term if you're interested in a specific type of program or a specific program title. It's a searchable database. And if you click on a particular name of a specific program, that's going to take you to a page with very detailed benefit cost results. So you'll see summary results, but you'll also see the results broken out by who in society will benefit, the participants, taxpayers, others. And you'll also see the outcomes that were impacted in order to create that monetary result. You'll also see lists of the meta-analyzed effect sizes that went into the analysis, and you'll see a chart of cumulative cash flows over time to kind of give a sense of when the program, if it does pay for itself over time, when that program eventually breaks even. So those results will all be updated very, very soon. And another development that I wanted to tell you all about is the ongoing work that we're doing with the Results First Initiative, which is a joint project between the MacArthur Foundation and the Pew Charitable Trust. We've been working with them for the last several years to create a version of our benefit cost model that can be shared with other states. So the Results First initiative actually has a technical team that goes out to different states, presents them with our model, and helps them find the data in order to populate the model with state-specific inputs. So you can see the states that are participating in blue on this screen. The fact that California is blue is a little bit misleading. At the moment, it's not a statewide initiative in California, but there are several counties in California who are working with Results First to see if they can apply these approaches at a county level rather than a state level. And so the importance here is that each state has potentially very different costs of different services and potentially very different background populations. So what the Results First initiative is trying to do is work with all of those states to get those inputs specific to their state so that they're starting to get meaningful information out rather than relying on the Washington state estimates. So that's a work in progress, and on the next slide I have a link to the Results First page. If anyone in the audience is interested in connecting with someone at Results First and seeing what's happening in their state, then there's a link to their website on the next slide. So again, thanks so much to CEBC for hosting this webinar, and I'd love to hear more questions if you've got them, and thanks to all of you for being here today.
If you have any questions, please type them in the Q&A section on the right-hand side of the screen, and we'll have Stephanie answer them as they come in.
Okay, so first question is, which California counties are using this approach? At the moment, I know Santa Barbara County and I believe Santa Cruz County, and the third one is escaping my memory at the moment, but you can always send me an email at slee@wsipp.wa.gov, and I would be happy to track that third county down for you. Or you can alternately, you can go to the link at the bottom of the thank you screen and check out the Results First website. They may have the specific information there. Next question is, for the benefit cost results, is it possible to find the breakdown of the calculations or more detailed input costs somewhere on the website? And yes, it is. So on the website, there will be links to the detailed results, which will show how the benefits break out across the different outcomes. If you want information on the input costs, then I would recommend downloading our technical manual, which again will be available on the new website. There are screenshots of the actual tool that we use to create our benefit cost analysis results. And there are specific descriptions of the different inputs that we use on those screens. And then finally, if it's possible to find the breakdown by year, we do present the cumulative cash flows over time. So that's by year. It just breaks down by it's sort of all-inclusive cash flows, including costs, including benefits from all different perspectives. So it's just a single graph, but that will be available on the detailed results. What other states publish this kind of analysis? To our knowledge, there aren't any states yet who are publishing this kind of analysis. New Mexico has been really working to adapt our approach and take it and publish some new results. But I think other states are still working kind of on the input side of the equation. And as far as we know, our organization is somewhat unique in the United States in terms of how we're situated to serve the legislature, but sort of outside the state legislature as an objective and nonpartisan research group. And we haven't really been able to identify other groups who focus so heavily on the economic analysis, but we're always open to talking to them. The next question is, how generalizable are the Washington cost data to the other states? And honestly, they're not terribly generalizable, unfortunately. There are very likely a lot of similarities between a lot of states and the costs and benefits that we present from Washington's perspective. But without doing in-depth research into the different costs of the systems involved in different states, it's really difficult to make any sort of generalizations about those outcomes. The next question is, did you assess any supervised access programs? And to my knowledge, no, we have not. If you've got evaluations that you would be interested in us reviewing, you're more than welcome to send them to me. And we're always open to looking at new things and especially reading new high-quality evaluations. That's one of our favorite things. Next question is, how do you derive your discount rate to calculate your benefit cost net present value? Is it fixed or does it match inflation? It's the average discount rate that we use is 3.5%, and that is based on some recommendations from national economists. We allow that discount rate to vary between 2% and 5% when we do our risk analysis. So in that long, the average results that we present from our risk analysis, that discount rate is allowed to vary, but it centers on an average of about 3.5%. What is the minimum length of follow-up data needed for cost-benefit analysis? And that question depends on the outcome being considered. So if you've got, for example, if you're looking at a child abuse and neglect outcome, if we know what happens to a child a year after intervention, we can usually estimate the difference between the program group and the comparison group and put an effect size on that and monetize that out into the future. But there are certain outcomes like high school graduation that you can't measure unless you follow a child until they're about 18 years old. So really depending on the kinds of outcomes that are measured, you need different levels of follow-up. Another question is, did you get benefit cost ratio through Logit or Probit or anything else? Sorry, let me just read this. I'll read this to myself before I start sharing it with everyone and see if I can get a handle on it. Okay, so when you talk about the benefits, such as increased educational attainment, did you run any tests to prove that there's significant improvement compared to those not in the program? If the improvement is not significant, should we still include those numbers in the benefit calculation? So what we do is when we compute our effect size, we also compute a standard error around that effect size. And oftentimes what we'll find when we meta-analyze the results of a number of different studies, sometimes the meta-analyzed results come out statistically significant, and sometimes they don't. But there's always a standard error associated with that. So in the cases of non-significant results, the standard error is quite large. In the case of significant results, the standard error is quite small. So when we run our risk analysis, we include that standard error in order to define the distribution that the risk analysis is going to draw from. So it'll have the same mean value if you've got a significant versus a non-significant result. But if you have a non-significant result, it's going to result in a much larger standard error band, so a much larger range of possibilities for the random draws to draw from. So essentially what that does is it decreases our, if we have a non-significant result, we still include it in the benefit cost analysis. But with that standard error, we're essentially increasing the risk. So we're saying if you are allowing a much wider range of possible values, what that does in essence is lower that risk number. So it means that you might go from a 76%, if you've got a very tightly defined distribution, to maybe down to like a 65% if you've got very widely defined distributions. And I hope that was somewhat clear. But yes, we do include the non-significant results because there is a result, but it has, again, a much larger standard error. See, another question here, do you ever look back at program changes that were made to see how well the actual costs match your predictions? And there have been a couple of examples of this in Washington State, especially early on with juvenile justice programs. Some of the early investments in juvenile justice programs were evaluated and found actually not to work as expected. So with a little bit of digging, what was found was that certain programs weren't actually being implemented as they should have been. So after some back and forth, there was actually a quality assurance implementation process that was instituted in the juvenile justice system that helps to ensure that the outcomes that we would expect from our analysis are actually going to show up in our actual program budgets. That's a process that will very likely expand into other areas as more and more people start picking this up. But whenever we do program evaluations in Washington State, we actually include our own results if we can get a very good program match, for example. We include our own results into those meta-analyses to get more and more sort of closer and closer to what's actually happening in Washington State. So yes, we do try when we're able to try to track and make sure that our results are lining up with what we would expect. Oh, here's a great question. To what extent does the legislature listen to your recommendations? That varies, I would have to say. The legislature seems to trust us as an objective source of information, but the legislature also has a lot of other sources of information coming in. So there are certain areas, again, particularly with criminal justice, where the legislators who are on those committees making those decisions are very familiar with our work and have seen us do kind of the checkups over time and the outcome evaluations and are very likely to listen to the recommendations that we publish. In other areas, we're still working toward identifying those things. However, I should mention that our legislature has recently assigned us several different pieces of work in a number of different areas: child welfare, child mental health, juvenile justice, adult mental health, and adult substance abuse, where they've actually asked us to put together inventories of evidence-based and research-based programs that they can work from on an agency level. So the legislature does seem to really trust our results, and they're asking us to produce more and more information that's actually getting used on a day-to-day basis by people in different agencies around the state. The next question is, was the wraparound model as applied in child welfare studied in the programs listed in slides 10 and 11? I'm fairly certain that the wraparound model that we investigated was focused on kids with serious emotional disturbance, so it may not be exactly the modification that's used for kids in the child welfare system. I'm pretty sure that those are mostly focused on mental health populations. Let's see, is the cost-benefit analysis done on PPP available for review? And yes, it is. It is on our website. The April 2012 report, until our new website is live, is the latest place to find information. The new website will have the links to the PPP cost-benefit analysis for both the child welfare outcomes and for the mental health outcomes. That's all publicly available. It will be posted on the website shortly. And then please explain the deadweight factor. So that the deadweight cost of taxation is really, it's a factor that economists love to use to estimate the additional cost to society of raising taxes. So the idea is that when you have to use taxpayer money to pay for something, there's actually additional costs associated with that in terms of productivity and administration and so on and so forth. So when a program actually costs a large amount of money, there's a factor applied that kind of adds additional costs to that program that are sort of these unseen costs that the legislature isn't directly paying for. They're not direct program costs, but they're these additional deadweight costs to society. So they get included in that societal perspective. In addition, if you are benefiting taxpayers, if you're increasing taxpayer revenue or decreasing taxpayer spending, you also get that additional benefit of those increased productivity factors as well. So that deadweight cost works on both sides, the cost side and the benefit side of the equation when you're talking about taxpayer costs and benefits. Let's see. And then there's one more question here about my email address in terms of if you have evaluations to send to me. I would love to see them. My email address is slee@wsipp.wa.gov. And if you go to our website, which is listed on the slide in front of you, there is a staff section where you can find my contact information as well in case, if you wrote it down wrong or if there's any complications, you can also find me directly on the website in the staff section. Okay, so let's see. Here's a question about attempting to use the information in other states. So if you were attempting to use the benefit cost results in other states, how would you disclaim it and how would you use it? And it's a difficult question that we've gotten quite frequently. Essentially, we just say, these numbers were produced for the Washington State Legislature with Washington State specific input. And so they might serve as a general guideline for other states. But, in order to get real state-specific results, you'd have to actually do the analysis yourself. But I think, generally speaking, I think the overall findings can be used as sort of general guidelines to what might be successful from an economic perspective. Here's another question about the inventories that I just mentioned that are being developed for agency-level use at the request of the legislature, asking if they will be publicly available and when. The first inventory that was compiled for child welfare, child mental health, and juvenile justice was actually originally published in, I believe, September of 2012, and we recently completed an update of that inventory in June of this year. That is listed on our website under research-based programs and potentially a number of other areas. But yes, those reports, those inventories and their associated reports are available on our website. And we also have another update of that particular inventory occurring in January of 2014. We work with the University of Washington Evidence-Based Practice Institute to compile those inventories and review the programs that are nominated. The adult mental health and substance abuse inventory will be available in May of 2014. We've got 2 analysts working on that right now, and so there should be a pretty comprehensive inventory available, I believe, around the 15th of May, so sometime in the month of May. Right. So it looks like that's the end of the questions so far. Thanks, everyone, so much for your really thought-provoking questions. And please do email me. Feel free at any time if you've got further questions or if you'd like to send me evaluations, for example. I'd be very happy to take a look. Thanks very much.
I would like to take this opportunity to thank everyone for attending and Stephanie for presenting today. In about a week or so, the recording for this webinar will be uploaded onto our website, the CEBC, and I hope you all have a great rest of your day. Thank you.